I'm actually getting better, longer lasting results when I incorporated ANF into my practice. Probably, I want to say, I don't know what I would do without it. I get good results, but adding that ANF therapy to my practice, it helps them longer term. We're not needing like closer appointments. We can actually go out farther because of that.
Hello, everyone, and welcome to new ANF Academy podcast. Today, I'm talking with Joani from Ohio. She is a licensed massage therapist, and she works with ANF Therapy. Hi, Joani. Welcome to the new ANF Therapy podcast. Nice to meet you. And how are you? It's early morning, right, in the States?
It is early morning. It's about 7:30 my time, AM. So yes,
Do you
good
usually
morning.
start your mornings with having an interview?
Not with an interview, normally with clients. I usually start my day as early as 6 a.m. So
Do you work in a clinic or you have your own practice?
I have a private practice, my own practice for 21 years.
Oh, wow. What are the
Yeah.
most common issues you treat in your practice?
Most common are shoulder issues, knee issues, back issues, and you name it. I've worked on every body part there is. I'm more issue specific instead of doing the relaxation massage, just very issue specific.
Do you treat older people, younger
I
adults?
treat anywhere from newborns to my oldest client is 90, 95.
Whoa.
And he's moving. He's always working out, and I use the ANF therapy on his knees, and it keeps him moving. He's had stem cell. He doesn't want a knee replacement, and so with the help of ANF, I keep him working in his garden and playing golf and whatever he wants to do. Yeah, absolutely. So
Before you
yeah.
integrated NF into your practice, did you treat the same issues? Or now when you have NF, you can treat much more than you could without it?
Exactly, exactly. I'm actually getting better, longer lasting results when I incorporated ANF into my practice. Probably, I want to say
Okay.
10 years ago. So I don't know what I would do without it. I get good results, but adding that ANF therapy to my practice, it helps them longer term. We're not needing like closer appointments. We can actually go out farther because of that. And then I give them, some of them I'll give at home protocols too.
If you can go back in time before you started using NF, what other tools did you use in your clinic? If you can, because it was 11 years ago, if we can go back in time, what would you
Okay.
say? Were you satisfied with the results back then? What were the issues you treated back then?
Same issues, again, always issue specific, orthopedic issues, I would say. Some muscle, a lot of scars. And I would do, so I'm thinking back in the day, I do bioelectric lymphatic. I do a lot of lymphatic work. I do a modality called myoskeletal alignment. So it kind of combines chiropractic, physical therapy, and massage in one modality. And I had a lot of good results with that. I'm trying to think, I did like kinesiotaping, like Graston technique, with the tools like this would do that.
I know.
The results were good. I mean, I have a reputation in Ohio, in Toledo, of being a voodoo, so I could always help clients, and I was getting good results. Were the results great? Sometimes yes, sometimes no. And I had, I'd see a client for, you know, every other week or every week, depending on the issue, to get them, strengthening their areas that needed it. So I would say the results were good, but it's like I just need to say this, when I found ANF, it helped me be a better practitioner because it enhanced my palpation skills.
Okay.
That's the biggest difference. My palpation of a client, of an issue, has gotten better because of ANF. So I'm not just, I do some muscle testing and all of that, but it's that palpation is the key that has changed the way I do things.
Can you compare the palpation skills you
Oh,
acquired through NF Academy and the skills you acquired through, let's say, university and years of experience? What is the difference?
I guess I became more in tune with the body because I wasn't just looking to go, oh, I need to treat a bicep tendon. I wasn't just feeling the bicep tendon, I was palpating the area to find out why, to find out, because that might have been the end result of something else going on. So those palpation skills that allowed me to be more in tune with the tissue, the body, the client, and I just felt my palpation got really, really good. I mean, now I can pretty much go, oh yeah, I go here, yeah, that's not good, but I'll go over here. This is a little bit more spongy, um,
Mhm.
and then I can treat it as such. Does that make sense?
Yeah, so you would like to say that to university you gain basic palpation skills that
It
didn't allow you to
absolutely.
connect dots.
Correct, correct. It was just like, this is what we teach you. We teach you enough to get you through state boards. You know, you need to be able to massage this and friction this and whatever, and that was all good. And I did have good, working with Eric Dalton's myoskeletal alignment. I got it, but again, I wasn't always palpating. I was moving. I was
Mm-hmm.
moving a joint. So, I mean, I was palpate, but it'd be like, but ANF, I mean, when we talk about the hierarchy, and that's how I treat my clients, with the brain and the breath and then the scars, lymphatic, and the organs. And when I treat it like that, I mean, I don't even hardly touch muscle and structure anymore
Can you elaborate
by
it? Because
following his.
I think those that are going to be watching this interview, they don't know what that exactly means, the hierarchy. Can you explain a little bit?
So
Deeper?
when a client comes in, the first thing I look at, I look at their intake. I have a very thorough intake. We look at, have they had concussions? Have they had whiplash? Have they had car accidents? And making sure that they're breathing well. Making sure that everything. And then if they have any scars, we treat that. And I've had. I'll just throw this little tidbit in there. I'm going to kind of go off on a tangent. Scars and the ANF therapy are amazing. Using like the human growth or the stem cell or whatever to really make a change. And then we do lymphatic work. I do a lot of lymph protocols, and then the organs, looking at the liver, whatever comes up, gallbladder, because those are all referral patterns in the body parts. So if I've assessed somebody a couple of times in the shoulder and there's nothing structurally wrong through palpation, then I go to the organ. And then a lot of times we disc it and it takes care of itself and the pain goes away. And my clients just kind of look at me like I'm a witch doctor, I guess, or a voodoo person. So yeah, that's
So
the change that I've made.
you have a different view of a human body. You have a different approach, more a holistic approach.
Way different. Yes, way different. So, add palpation, yeah, that's great, but it's also given me a different way to look at the body. It's not just, again, going back to the bicep or going back to the knee, yes, there's an issue, but if it's a structural problem, then we have to look at it something different. But I would say probably 8 times out of 10, we fix it with just dealing with all of those, unless there's, like I said, unless there's a structural damage, like a tear or a fracture or whatever. I
Understand?
will say that the fractures, I've had a couple clients with foot fractures and disking them, and their healing has like been like exponentially quicker than if they were to just been put in a boot or whatever. So
Do you get
yeah, it's
long-term
been.
results, or they come back with the same
Oh yeah,
issues after a while?
I would say probably the complicated ones like the fractures or the tears or whatever, we can usually get relief probably within 2 to 3 visits where they're
Wow,
getting
nice.
that long term. Yeah. I have one client, she kept going back to the doctor. The doctor's like, there's nothing wrong, there's nothing wrong, there's nothing wrong. And so for 6 years, I helped keep her knee stable with ANF, some body work, very little body work, but all ANF. And she just had her knee replaced. It's been 6 years. I kept her stabilized so she could play tennis and pickleball and with no pain, with no pain. And I would see her probably once a month. What I'd like to say is that ANF, I mean, it's a game changer. I mean, she's the one that calls me the voodoo lady. She's just like, you kept me moving. But they found that there were some other issues that the MRI had missed and all of that. And we knew there was something wrong. But she kept going, and I used the ANF knee protocol and stabilization, and I mean, she was a happy camper. So
So you would like to say that NF is your main tool in your toolbox?
um, I would say it's yes. If I had three modalities, that would be probably number One.
What would be the other two?
I do something called E plus, a guided PEMF, where the client's connected to electrical coil, and I use my hands to palpate, find muscles that are working and not working. That's the
Mm-hmm.
biggest reason. Um, and then I do the bioelectric lymphatic, and that's it. And the bioelectric lymphatic has kind of been put on the shelf because I don't have a need for it a whole lot anymore. And I always tell my clients that this is not, this is to continue the work that I've done, with ANF. I said, but it will continue to reduce that pain and inflammation. It'll help your neurological system work better. The mental focus, I didn't even put mine on this morning. I usually wear mental focus here. And my clients think, they look at me, clients, they're like, what is that? I'm like, well, this is where I plug my cell phone charger in at night, because that's what I tell people that on the street when they're like, what is that on your forehead? I don't know where my practice would be without it. I have to say that. I'd have a good practice. I mean, I'm busy, but people go, hey, you're the lady with the dots, right? Can I,
With the
can I,
dots.
or the stickers? I mean, it's like when people are on the tennis court, it's just funny. They will say, oh, you must be seeing Joani because she's the only one in Toledo that does this. Um, they're like, yeah, where can I get some of those? So it's just,
Are they
but
open
they
to
know.
hear and try, or they're skeptical?
No, they text me. Are you the lady with the dots? Can I make an appointment with you? So sometimes they'll come in and they're like, well, I don't want to wear them out in public. I'm like, you're going to be fine. They'll last 3 days, blah, 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 whatever. When clients walk out of the office with these discs on, with these ANF discs, it's just their life changes. And it sounds really kind of hokey, but it's not. Clients will text me and say, I don't know what's in these discs, but I either slept well, I'm moving better, I'm breathing better, and I feel better. I've had a couple that are skeptical when I put them on, especially the guys that come in with back pain that have, one guy came in with foot drop. He doesn't want to have surgery. I'm like, well, I can't fix that, but let's see what we can do. Through assessment, I dissed him and he walked out and he's like, I don't have my foot drop. What did you do? And I'm like, my job, and he's like, what kind of medicine are in these discs? What did you put in these discs? I'm like, it's all frequency. And because of ANF, I want to move my practice to more frequency work using ANF, doing something called brain tap. It's a
Okay.
headpiece with lights and sound that helps with the brain waves. So here's the piece that I'll tell you. I do something called neural check. It is we do an ECG and it shows me the brain and what it's doing. So alpha, beta, theta, gamma, and delta. Most of my clients have a very high delta, so it means they're not sleeping, they're stressed, concussion. What happens is I'll do an ANF treatment based on their symptoms or whatever. 3 days later, they'll come back. I'll do another neural check and it's
And it's
changed.
optimized.
And it's changed. And they're like, I don't understand. We're repairing your neurological system and the brain is the top of it. So if we can fix the brain and give it a safe space to play, so frequency work. So the discs, the brain tap, not so much hands-on, I'll show you.
You can
Sorry.
also be like a mobile therapist, right?
Absolutely. And this is the brain tap. So it's just a headset. And they sit for 30 minutes. I do the ANF and that. And it's just, and so I've played with it because I'm like, I
Mm-hmm.
want to see the results with just brain tap or just ANF or
Mm-hmm.
together. And the
Mm-hmm.
results are better with both.
So you use the first
But
one to
ANF,
analyze, and then you use NF to treat.
I find out what their issue is. And
Mm-hmm.
then I do the neural check first. And
Mm-hmm.
then I do the discs. And then I have them come back 3 days and see the change. Then to enhance that, because I already know the ANF is working, then I add the brain tap. I'll add a 20-minute session. And the results are good, but I know that ANF works better. I mean, honestly, that's it, it is because it's repairing the body. So we
Yeah.
can change those brain waves. People are sleeping better. Their stress levels coming down. I'm getting clients
Do you
to
have a
be better
favorite
hydrated.
device that you use on most patients, or device that you like to use on yourself or a family member?
So so for me, I do a lot of AGLS, ACAS on myself. The mental focus. I love mental focus because I don't have a lot of issues. I'm healthy.
Mm-hmm.
My sugar, all of my, my numbers are really good. I like P400s for my clients that are, that have structural bone, like bone issues.
Mm-hmm.
A lot of melatonin. I like stem cell. I like human growth. I love those two together.
For
Yeah,
what kind of
there's not
issues you use these two?
the stem cell, and so the human growth I use on ligaments a lot, like stretchy ligaments, clients that
Mm-hmm.
have an instability. Human growth, stem cell, the mental, the MCS on the C7 is a good one too for my high strung clients. God, they're all good.
She mentioned glutathione and carnosine, which are the antioxidants, and she
Yes,
mentioned P400, which are like devices for pain and inflammation. The
yes,
higher the frequency, they work on a deeper level, right?
correct. The P200 is a really good go-to as well. P200, P negative 9,
But they
the
work
pain disc.
more superficial, right?
More superficial, absolutely. Tennis elbow. I have a lot of those, and the P200, P negative nines. I always do the carnosine and glutathione because they just help tissue repair quicker. I just for like tendons and ligaments, I use the human growth. I just find that along with the pain disc. Depending on if it's a superficial or deep, they're all my favorites. Nitric oxide is good too. I do
Mm-hmm.
that with clients with blood flow problems, that and the blood flow disc, and the nitric oxide. I do those on and a lot of lymphatic discs.
Just to
Just
clarify, nitric oxide and blood flow is part of optimizing cardiovascular system, right?
correct, yes. So here's the other thing. I have a thermo camera, so I do so again proof.
Mm-hmm.
So clients that have poor circulation in their feet. Um, I have an 89-year-old man that has poor circulation, and so I'll do the nitric oxide, the blood flow, and some other lymph on it as well. And I do a pre-picture with the camera, with the Seek thermal camera, put the discs on,
You can see the change in
and see
color
the change.
becoming
Yes,
warmer.
and then you take it afterwards, and then you show them, and they're like,
Mm-hmm.
I just don't understand how these work. And I'm like, it's all about getting your body to help it to self heal. And these discs have that frequency, and that frequency helps repair your neurological system, which is what you need. And then I show them an anatomy picture with the nervous system, the circulatory system, the lymphatic system. And I said, it all works together. If this isn't working, none of these are going to work. It's also about educating the client, educating them about your body is meant to do this. And if it can't, I'm going to help it. And
Mm-hmm.
I do it through ANF, and you can't deny the results.
Can you decrease any pain during the first session?
Absolutely, absolutely.
It doesn't
I
matter
would
if it's chronic or acute.
Does not matter. Does not matter. So I had a client call me. She was referred by one of I see a lot of medical professionals too. I have a lot of doctors on my tables, from orthopedic to cardiovascular to endocrine doctors. They're on my table as clients. Every single one of them. So was referred a client. She's like, my hands. It's hard for me to walk. My hands hurt. I can't grip anything. And so we went through a history, all of that. And I did an ANF protocol down the spine and the neck. And she got up off the table and she's like, I have no idea what you just did, but I have no pain in my legs and I have no pain in my hands. And I tested her grip before. Her grip, I had her grip my hands before and after, and exponentially grip strength increased tenfold. And she just looked at me. She goes, I don't even know what to do. She had a visit scheduled to a University of Michigan up north. They needed to rule out MS. That's what they were thinking. She had MS,
Mhm.
and she doesn't. She just sits so much. She doesn't move a whole lot that her spine is actually compressed. One visit. So now she's a regular client, and I work on her a little bit using the guided PEMF, the Electron Plus, and then I disc her, and it'll last 3 days. But what's happening is that after the 3 days, the pain isn't even coming back as much. So when the
Yeah.
discs come off,
Yeah.
she's getting longer time of feeling better. What we're doing is reducing all the inflammation from the compressed nerves. That's, stretching her out, getting things moving. and the ANF discs are helping that recovery to go even better. So,
Would you say that our lifestyle is what makes us sick?
oh, absolutely.
I
It's
understand that some things we cannot influence, like the external factors, we cannot have an impact on that, but our
but it's how
daily
we respond to it.
habits, how we respond to
Absolutely.
that, plus our daily habits.
Absolutely. I mean, I wish I could show you. In fact, I'll send you some pictures later on after we're done. But I have a client. I got her out of pain, discs, some other work, just what she was comfortable with. She does not move. She doesn't walk. She just sits in her house, plays on her computer, her phone. Um, so I wanted to kind of see what, and she doesn't sleep. Her sleep habits are off. This is a choice. I'll disc her to help her sleep. I give her the protocol to do at night. And her husband says she doesn't do it. So her sleep habits are off. So she sleeps during the day and is up all night, or she doesn't sleep. Maybe she'll sleep for 2 hours. So it's lifestyle. All we need to do is move. Doesn't matter if you just walk. You don't have to be in the gym schlepping weights, but you need to hydrate and you need to put good stuff into your body. It'd be like me getting up every day and, I don't have coffee anymore. I have water. I have a smoothie or a green drink. I disc myself, because I know what I feel. I'll be very honest, Taya, that I have fired clients that don't want to participate in their recovery
Yeah,
because it's a two-way street. You're spending a lot of money with me. If you're not going to do what I ask, it's really not fair to either one of us because I have a waiting list for people to get in. And I'm doing 40 to 50 treatments a week. So
yeah.
ANF has also helped save my hands.
But
um,
did patient compliance increased, if I can say increased, since you integrated NF in your practice? Because
yes,
what I can see based on the interviews I do with the therapists before NF, if they like a physiotherapist or physical therapist, how it's called in the States, if they have to prescribe exercises, people go home and they do not do them because the pain is preventing them from doing it, I guess.
absolutely. Yeah. And, I tell my clients never move into pain. We don't want to do that. But through ANF, because I can give, so I'm also a certified corrective exercise specialist. So, I can give them movement drills. If I'm not going to see, and then I'll say, okay, 3 days, and then, we'll do another, take a day off. I want you to still do your exercises and then do the second protocol that I've given you. And they do it. So my patient compliance has gone up because the people know that I'm serious about it. We are a team here. It's not just Joani fixing you. You got to participate. And there are some people that don't get homework because they don't need it. Because it's not an issue. The compliance I would say has gone up because if I can
Mm-hmm.
keep them out of pain, they can do what they
They're
need
more
to do.
compliant with the treatment.
Correct. Hydration is a big thing though. People are like, well, I have a cup of coffee or I do this. I'm like, no, drink your water. Drink your water. You need water. And I'll tell them these discs work on body heat and hydration. And if you're dehydrated, we're not going to get and I have stopped this treatment and gotten a client a bottle of water and had them drink it. So, the disc will work better. Yeah, but it's better. Patient compliance. Absolutely.
Was there one case that even you were speechless when you saw a result? Like,
Well,
you know what I mean?
it, yeah, if there was one case that stood out, oh my gosh. Well, one would be the foot drop. That was a major one because, this guy he didn't want to have surgery and he's still not having surgery and his foot drop is still at bay or
Mm-hmm.
it's not. And I see him every 3 weeks, just, come in but that's the thing is that using the discs and doing the protocols and palpating to find out where I really need to place these. I mean, we're getting longer term results, and it's just. But that one was probably a big one. I was like, whoa, I do know what I'm doing.
Do you have a message for your peers and about NF?
Ooh.
Like, is there something that you would like to tell to those that heard about the NF but never tried or never heard about NF?
For those that have heard about it and aren't doing anything about it, you need to drop what you're doing and learn. I mean, because it's a game changer. It's a life changer. A game changer for your practice, but a life changer for the clients that you're going to work with. For those that haven't heard about it, do your research. It's call me. I mean, I'll talk. I just have to say it's a life changer. It is a life changer for the people that you're going to come in contact with. It, and I disc myself, and I'll go out in public, and this is the thing, is that it's a conversation starter. So people go, what is that? It's a frequency disc. I go through TSA with them when I'm traveling. I have one on my forehead or whatever, or one on my thyroid, and they're like, what are those? And it's not about, for me, it's never about the money. It's always about helping people. So if I can start a conversation with somebody that doesn't know about ANF, other therapists that I work on, now I'm trying to get them enrolled in it. Practice. It's a life changer. That's my message. A game changer for your practice and a life changer for your clients.
Thank you, Joani.
You're
If
very welcome. Thank you. Thank you very much.
if you people that are currently watching this podcast uh, are from Ohio and you have any kind of issue, doesn't matter is it acute pain or it's chronic pain or it's tennis elbow or it's golf elbow or it's frozen shoulder. I said those three because I know it's very challenging to treat without ANF. You can
Absolutely.
reach out to, can you share your clinic's name and where you're located?
My clinic is 3D Wellness. I'm located in just 4001 West Central Avenue in Toledo.
There is a waiting list.
There is a waiting list, unfortunately. I have people wanting. I had a lady text me, "Are you the dot lady? Can I get in tomorrow?" And I'm like, I don't have anything until June, so unless I get a cancellation. But yeah, it's a game changer.
I have to
It's a
ask
game changer.
one more small question. Does that waiting list has anything to do with ANF?
Yes,
Yes.
yes. I would say I have. Okay, so all honesty, I have 37 clients on a wait list right now that want in. And I'm at the max right now per week. I'm doing, like I said, 40 to 50 a week. And out of those 40 to 50, 90%, 95% I go through are all ANF related.
It's nice to hear. It's nice to hear, especially from my point of view, that people are actually seeking something more natural, something
Yeah,
that's actually
absolutely.
helping their bodies. It doesn't have side effects,
No, and when
and it
people can
works
stop
within the
taking
body.
pain, yeah, absolutely. When people can stop taking pain meds or taking too much Tylenol or too much ibuprofen, or their NSAIDs for whatever, that right there is a lot, and they come in and, like I said, we're getting longer results and their pain is gone and they're moving and, they're participating in their life and they like that natural alternative other than
Yeah.
just popping pills all day. Yeah,
But it's
absolutely.
also mindset. I think years of being used
Absolutely.
to pill for this, pill for this. We're not used to having another solution, but now
Correct.
there is. NF therapy. Thank you, Joanny. Thank you for this
My
wonderful interview.
thanks to you. Have a great day.